What you've just heard isn't a quirky hack, but a way to reset the tempo. Respect hygiene, a warm warm up, holding the rhythm once the body has caught the wave, telling wet from ready, going deep with control, coordinating inside outside, then a soft landing. If by now you feel less tangled, subscribe so you don't miss the next part, where I'll show a morning food that helps the body boost natural circulation signals for those over 60. And so I can speak more precisely in the next video, leave a 1 if this content hits home, a 0 if you're still stuck, plus exactly one word naming the snag. I read everything. Next time, we'll raise Tucson's cup of coffee one notch, less noise, more staying power. So the smooth rhythm in bed has an ally from the kitchen. What you've just heard is adult health education, not a substitute for direct medical advice. If you or your partner have persistent burning pain, abnormal bleeding, painful urination after intimacy, fever, discharge with an unusual odor, or fear spasm pain every time you're touched, stop and see a doctor. After 50-60, the mucosa becomes thinner and the pelvic floor tightens more easily. Sometimes you need an appointment with a urologist, gynecologist, or a pelvic floor physical therapist to learn how to release properly. Anyone on anticoagulants or with cardiovascular disease, diabetes, kidney disease, or a history of recurrent urinary infections should consult a doctor before changing intimate habits. Fragrance allergies and lubricants can irritate the mucosa. Favor simple. Are hands just the prelude? And then forgotten? Does wet already mean ready, so you rush to keep the pace every time she gasps? That's it, don't change. Do you switch because you're afraid of being boring? If any of these lines makes you flinch, then tonight I, Dr. Emily Carter, urologist, men's health, will give you a concise, safe, evidence-based roadmap so your hands stop being a stopgap and become the conductor of the entire intimate symphony. In Tucson, James Walker, 62, married for 38 years, still loves like the beginning, yet closeness often ends in nothing by the third minute. The problem isn't a lack of affection. The problem is that rhythm and the way the body opens have changed with age, while the hands haven't been properly guided. In the next 8 minutes, you'll get 3 things you can apply tonight and measure tomorrow morning. 5 hand techniques illustrated with a rhythm pressure safety diagram to help the body catch the wave and stay there. A 3-second consent line that keeps feeling while respecting boundaries. And a physician-recommended hygiene routine so you feel confident and avoid unpleasant mishaps. If this section hits home, subscribe so you don't miss what's next. And give me a very light signal. Comment 1 if it's helpful, 0 plus stuck. If not yet, I read everything so I can be more precise next time. Next video, guiding erectile recovery after 50 where meds don't reach. A morning habit that lets circulation do the work circulation is meant to do. For now, don't rush to talk about tricks. Every good piece of music begins with 2 bass notes, consent and hygiene. Without them, no matter how beautiful the technique, it slips from your hands. And that's what we'll open up in the very next section. Without permission, there is no sensation. In Phoenix, I always start with 2 very short lines that build a safe frame. May I touch you here? And does this match your rhythm? That doesn't kill the mood. On the contrary, it releases the latch of worry, lets the shoulders drop a notch, and lengthens the breath. When a woman knows she's being guided with respect, oxytocin rises and the body unlocks faster than any trick. Hygiene is the same. Nails trimmed and smoothly filed, hands washed with warm, soapy water. After 40 and 50, the mucosa gets thinner, so a tiny scratch can turn pleasure into several days of discomfort. James Walker says that the moment he saw me set a nail file by the sink, his wife smiled as if reassured. 2 small things, yet they're the green light for every rhythm that follows. And so I can be more precise in the next part. You can leave a 1 if consent and hygiene has eased your tension, a 0 if you're still stuck, plus exactly 1 word naming the snag. I read everything. A good piece of music always has an overture so the strings have time to warm up. The body is the same. Don't rush straight to the center. Take a slow tour around the shoreline, shoulders, back, hips, thighs, then move toward the sensitive areas. The aim isn't to plant a flag, but to draw blood to the pelvis naturally. Once circulation arrives, nerve signals grow less noisy, and sensation stops flipping on and off like a switch. You'll notice your breath deepen, a light rise of goosebumps on the skin, the back curving for a beat. That's the body slipping into the music. 1 tiny bit of play, I'm practicing beautiful circles on a piece of paper that breathes, is enough to bring a smile and let tension leave the room. Warm-up isn't a side detail. It's the fuel for everything that follows. Many men start out right, then switch immediately, like flipping through 10 radio stations to find a louder song. Each time you change, the brain treats it as a new signal and resets the arousal curve. The body needs deliberate repetition to build. Rhythm and steadiness are the engine that pulls pleasure uphill. Read the breath quickening, the hips beginning to follow, the moans growing clearer. Those are green lights to stay the course. Don't switch just because you're bored. One tasteful whisper. We're not playing jazz tonight, so with your permission, I won't go off beat. Good technique isn't about the number of moves. It's about well-timed consistency. Arizona sun doesn't mean the freeway isn't jammed. The appearance of lubrication doesn't mean the pelvic floor has released its lock and the mind has lowered its defenses. Ask one short question. Do you want me to go deeper yet? And watch for the body's answers, an extended exhale, hips tilting toward you, the muscles around the entrance softening. If you sense a hitch, don't force it. Returning to external touch is progress, not retreat. Add a safe lubricant when needed. Today's comfort is tomorrow's good memory. Cross the threshold slowly as if stepping into a room where someone is napping. Gentle, lubricated, a brief pause so the body can register a new presence, then move one notch further. When the response is good, maintain steady contact along the anterior wall, the area sensitive to rhythmic pressure, while letting the outside be touched at the same frequency. Two synchronized streams of stimulation create a chord. The sensation becomes full and deep without heavy force. Mr. James says the secret to bringing the song back to the chorus is to treat yourself like the drummer. Once the whole room is clapping to the beat, don't change the pattern. Just keep the pulse to the end. Near the peak, change is the enemy. Steadiness is the ally. When heart rate and breathing are surging, the pelvic floor contracts in cycles, and the voice drops in tone. The body is asking you for one thing only. Keep things as they are. Don't get creative in the last 3 seconds. And when the wave passes its crest, don't pull out abruptly. Turn. The volume down, don't switch the music off. Ease the pressure and keep a light rhythm for a moment so the body glides down smoothly instead of free-falling. It's this stretch of aftercare that turns pleasure into trust, something remembered far longer than any flashy technique.